Hi, I'm Dr. Julia Schechter, and I'm a clinical psychologist at the Duke ADHD program, and I'm the co-director of the Duke Center for Girls and Women with ADHD. The Duke Center for Girls and Women with ADHD is a program aimed at advancing education among individuals, families, clinicians, educators, and the public about the unique needs of girls and women with ADHD across the lifespan. ADHD in girls and women looks different than it does in boys and men. Symptoms are often more subtle and less disruptive. Girls and women often develop strong coping skills to mask their difficulties, and they are often diagnosed with another psychiatric disorder like anxiety and depression before ADHD is recognized. Girls and women with ADHD are also at increased risk for serious negative outcomes if left untreated. The Duke Center for Girls and Women with ADHD seeks to address the challenges faced by girls and women with ADHD through educational resources and outreach that will help individuals and their families make informed decisions about evaluation and care and help girls and women reach their full potential. ADHD stands for Attention Deficit Hyperactivity Disorder. ADHD is a neurodevelopmental disorder, which means it has to do with how the brain develops. People with ADHD can experience high levels of inattention or high levels of hyperactive and impulsive behavior. However, some individuals have difficulties with both inattention and hyperactivity and impulsivity. Symptoms of ADHD first emerge during childhood, though may not cause difficulties until adolescence or adulthood. Yes, girls and women can have ADHD, including the inattentive, hyperactive, impulsive, and combined presentations. Boys are diagnosed with ADHD more frequently than girls. However, this likely does not accurately reflect the number of girls who actually have ADHD. ADHD symptoms can persist across the lifetime. In fact, the majority of people diagnosed during childhood continue to have ADHD or ADHD symptoms in adulthood. Generally, though not always, girls and women present with more inattention rather than hyperactive and impulsive behavior. Some inattentive girls may be called spacey and seem forgetful, easily distracted, and often appear overwhelmed. Hyperactive and impulsive girls may be called tomboys due to their activity level or seem more chatty and intrusive with others. Women with inattentive symptoms might have trouble focusing during conversations, become easily distracted while driving and get into frequent accidents, experience difficulty keeping track of their finances, have excessively messy personal spaces, or a tendency to forget details and steps in daily routines. Women with hyperactive and impulsive symptoms may be excessively talkative, have difficulties relaxing, have trouble staying seated during meals and while watching television, impulsively spend money, and receive frequent speeding tickets. Both girls and women with ADHD are more likely to experience internalizing symptoms like anxiety and depression. There's also evidence that females with ADHD are more likely to experience emotion dysregulation compared to males with ADHD and to other females without ADHD. Symptoms of ADHD may be more apparent for girls later in childhood compared to boys, or may be more obvious during times of transition, such as when starting a new grade in school or when going through puberty. Importantly, while ADHD symptoms may be perceived as less severe in girls and women compared to boys and men, they are at higher risk for serious challenges, including academic problems, social difficulties, trouble professionally, and psychological disorders if untreated. Girls with ADHD are more likely to present with inattentive symptoms such as trouble sustaining attention, disorganization, and forgetfulness. Inattention is usually less obvious and disruptive compared to hyperactivity or impulsivity, symptoms that are more commonly seen in boys. ADHD symptoms in girls may be misinterpreted, especially if a person has developed strong coping skills or is in a highly structured setting. Delays in ADHD diagnosis may also occur because girls and women are often first identified as having another psychiatric condition, such as anxiety and depression. These internalizing symptoms may be due to or exacerbated by underlying ADHD. Gender biases and expectations can also affect how others perceive and rate behavior, leading to delays in evaluation and treatment. In addition, ADHD has traditionally been considered a boy disorder. There's a misconception, even among some professionals, that girls and women cannot have ADHD. Education about what ADHD looks like in girls and women is critical and a central focus of our center. Studies show that girls are more likely to suffer delays in diagnosis and treatment, especially as compared with boys, and have difficulties that last well into their adult years. By their older adolescence and early adulthood, girls with ADHD are at a significantly increased risk for serious outcomes, such as eating disorders, mood disorders, unplanned pregnancies, self-harm, and suicide attempts. The good news is that there are multiple evidence-based treatments for ADHD, and these treatments work just as effectively in males and females. Evidence-based treatments include medication, such as psychostimulant medicines. There is some evidence that ADHD symptoms may be affected by hormonal fluctuations. Girls and women may want to track their symptoms over the course of their menstrual cycle and during certain periods of heightened hormonal changes, like puberty or menopause, and discuss these observations with their medical provider. Behavior therapy, such as cognitive behavioral therapy, or CBT, for adults with ADHD, organizational skills training for adolescents, and parent management training for parents of younger children with ADHD can also be effective at helping to manage ADHD symptoms. In addition to behavior therapies targeting ADHD symptoms, girls and women with ADHD may benefit from additional behavior therapies targeting co-occurring conditions, such as anxiety and depression, and developing coping skills for emotion regulation challenges. Talk to your primary care provider about your concerns. It may be helpful to keep track of some of what you're noticing so that you can share this information with your provider at your appointment. Collecting feedback from other people who know you well, such as a close friend or a family member, or someone who knows your child well, like a teacher or a coach, can also be helpful information to share with your provider. You may be referred to a mental health professional, such as a child psychologist or psychiatrist, who can complete a comprehensive psychological evaluation for ADHD. For more information about the Duke Center for Girls and Women with ADHD, including educational resources and helpful links, please visit our website at adhdgirlsandwomen.org and follow us on Facebook, Instagram, and Twitter at ADHD Girls Duke.